Good morning everyone. I'm Dr. Siddharth Sheth, and topic for my free paper is influence on angle alpha on modulation transfer function and higher order aberrations in eyes implanted with trifocal IOL. We do not have any financial disclosure to make. Angle alpha is the angle between optical axis and visual axis. Angle alpha is helpful in predicting visual outcomes in eyes implanted with multifocal IOL. Higher the angle alpha, it results in reduced visual quality and unwanted symptoms like glare and halos. However, there is limited literature available about influence of angle alpha on post-operative visual outcomes, particularly with trifocal IOLs. Acrysoph IQ Panoptics is a trifocal IOL which provides excellent uncorrected far, intermediate and near visual acuity. Panoptics is first US FDA approved trifocal lens. So we decided to study the influence of angle alpha on MTF and higher order aberrations in eyes with Panoptics trifocal IOL implantation. It was a prospective study done on 56 eyes who were implanted with trifocal Panoptics IOL. The study duration was between September 2019 to February 2021, and age group of the patients was between 40 to 70 years. We included the patient with best corrected postoperative visual acuity greater than 0.2 logMAR units. Subjects with IOP more than 22 millimeters of mercury, any other ocular disease, prior refractive surgery or intraoperative complications were excluded. Angle alpha is the distance between the center of visual axis and optical axis. So it can be measured in terms of angle as well as the distance between the image, the 2 points. Eye trace abrometer was used to measure the angle alpha at 1 month post-operatively. For statistical purpose, the eyes were divided into 2 groups. Group 1 included the eyes with angle alpha less than or equal to 0.45 millimeters, and group 2 included eyes with angle alpha more than 0.45 millimeters. We chose 0.45 millimeters as cutoff based on previous literature, where the mean angle alpha value was documented as 0.44 millimeter for preoperative cataract patients. Internal higher order aberrations were measured for fixed 4 millimeter pupil size using eye trace abrometer. Modulation transfer function, which describes the ratio of image contrast to object contrast, was obtained at spatial frequencies of 5, 10, 15, 20, 25 and 30 cycles per degree for again fixed pupil size of 4 millimeters using eye trace abrometer. 2 sample t-test was carried out to compare the MTF and HOA between the 2 groups. The mean angle alpha in group 1 was 0.33 millimeters, whereas in group 2 it was 0.56 millimeters. Internal modulation transfer function were better as seen in this graph with lower angle alpha, that is in group 1 as compared to group 2. But this difference was not statistically significant. The internal higher order aberrations were similar in both the groups. So we did not find any effect of angle alpha magnitude on higher order aberrations and modulation transfer function in patients implanted with Panoptics trifocal lens. This could be possibly attributed to the inner ring diameter of the Panoptics IOL, which is 1.164 millimeter, which is more as compared to other multifocal and trifocal lenses, thus tolerating more magnitude of angle alpha. Higher order aberrations are small but more complex refractive errors that cannot be corrected by glasses and are responsible for degradation of retinal image quality. In the present study, we found similar higher order aberrations in both the groups, suggesting no significant effect of angle alpha on higher order aberrations. In the present study, mean MTF was calculated at different spatial frequency, where MTF was found to be better in eyes with smaller angle alpha, but this difference was not statistically significant. To best of our knowledge, there is only one study which has evaluated the effect of angle alpha on post-operative visual outcomes in same IOL. However, they have not studied the effect on higher order aberration and modulation transfer function. So more studies are required to explore this area. Higher order aberration and MTF, both metrics are pupil dependent. So we used a fixed pupil size to calculate both the metrics, unlike previous studies where no information about the pupil size was mentioned. So to conclude, we did not find any effect of angle alpha magnitude on higher order aberration and MTF in eyes implanted with Panoptics trifocal IOL. This can be attributed to the IOL optic design, which can tolerate the larger angle alphas. However, a larger sample size and long-term study is required in not only in this IOL but other multifocal IOLs also to confirm the findings. Thank you.
How many patients did you have?
56 eyes, ma'am.
56 eyes,
Eyes.
divided into 2 groups.
Yeah.
Okay. And suppose one were not to use the panoptics IOL, you don't have a study on that with any other lens?
There is currently a study going on to compare between the panoptics and the other trifocal or multifocal IOLs to find out the difference between the two, whether the other IOL is performing similar to panoptics or no.
What is the maximum angle alpha you found in your
So we
group
found
2?
the maximum up to 6 in one of the patients.
0.60.
But yeah, so yeah.
Okay.
Any questions from the audience?
And did you find any difference between the toric IOL, toric panoptics and non-toric panoptics?
So
Any
in this
difference
study,
in
we have only included the plain panoptics,
Acha,
trifocal, not the
this
trifocal,
doesn't
not the
include-
toric ones.
not the toric?
Yeah, yeah.
And subjectively, did the two groups have any difference?
Subjectively, patients did not
There's
complain.
hardly any
Yeah,
difference.
yeah.
Did any of your patients complain about glare following?
That is the next paper.
Acha.
So yeah, that's
Okay.
the